We can make a difference tomorrow. We can make a difference in forcing competition in the healthcare market. But we can also make a difference in starting to restore some of the trust in this body and in Washington. People across this country do not trust Congress, and that's for good reason. They always hear about the special interests coming out ahead. Here's a simple thing. 2 pages, 24 lines long, that simply says the health insurance companies that are some of the biggest companies in the world should have to play by the same rules. If the plumbers in my district got together and started to set prices, they'd go to jail. Why is it that the health insurance companies should be able to play by a different set of rules? People are always saying, there are these common sense reforms out there. Why can't we get them done? Well, Ms. Markey and I have come together and taken that idea. It's not our idea. It came from people in our districts, conservatives and liberals alike, who agree that restoring competition and removing monopoly protections makes sense. When we've seen premiums double in the last 10 years, crushing the purchasing power of working and middle-class Americans, that's real for people. When you don't have to compete, the consumer loses. So people say, why can't you get these basic things done? Well, this is a chance, not just to do something good in the health insurance market, but show the American people we can come together. We already know this is a bipartisan bill. All of the attorneys general, without a single dissenting vote, said this is something we support. We want to be able to go after these monopolies. Jury after jury, juries of the American people have found this is going on, only to be overturned by the judges who say, sorry, because of McCarran-Ferguson, those basic monopoly rules do not apply. The antitrust rules do not apply. This is a chance for us to do a simple 2-page bill that puts patients ahead of the profiteering of insurance companies. It doesn't say the insurance companies can't continue to make lots of money. They can. We're just saying you can't do it by colluding and price fixing and doing the sorts of things that since Teddy Roosevelt we've put our foot down in this country and said are anti-competitive behaviors. And it should be a great chance for everyone in this body to show the people back in their district. I'm here to represent you, not the lobbyists that write the checks, not the $400 million that the insurance lobby spent last year in this city, but to say, I'm going to stand up for patients. This is not going to fix the entire health care problem. But why wouldn't we start with this? We know it has bipartisan support from the attorneys general. We know it has that bipartisan support from the President Bush Commission that came out and said this needs to be done. It moves us in the right direction to put patients and doctors back in the driver's seat. It allows us to restore the basic sense of competition in this country. And it says, for once, working and middle-class families are going to come out ahead of the special interests. Consumers are going to come out ahead of the greed mentality that you talked about before. We can do this. The American people sent us here to do this, to listen and find ideas that are not Republican or Democrat, but fundamentally American ideas and institute them. We will need to continue to have a debate about health care reform beyond tomorrow. But let's show the American people tomorrow, on the eve of this health care summit, that there are ideas we can come together on. We have that chance. So I come in to tomorrow with great hope not only that we will get this bill passed, that will restore a basic sense of competition, that will put patients first, but that maybe this can be a first step towards coming together in the health care debate to get things done.